Everyone, welcome to the Capital Budget Subcommittee. We are going to have the first agency come up. It's Judiciary, and the budget analyst is Jacob Polakov. Thank you very much, Mr. Polakov.
Thank you, Mr. Chair. Happy to be here to talk about the Judiciary's capital budget this year. To start with, on page 1, we have the summary of the capital budget for the state-owned capital improvement program. We see that in the 2024 request, the largest projects are the new Courts of Appeal building and the Shulman building conversion. In 2025, the same is true, and the Shulman building conversion project starts wrapping up after fiscal 26, with the new Courts of Appeal building being funded through fiscal 26 as well, and the Harford County District Court facility moving along in 2028 and beyond the scope of the current plan. On page 2, we have key observations. The first is delays have impacted project schedules for Washington County and the Shulman projects. Multiple delays have impacted both the schedule and the cost for the Washington County renovation and expansion and the Shulman building conversion, and the Judiciary should comment on what has caused these delays in both projects and whether or not more delays are expected. The Judiciary should also comment on the status of the events that have previously caused delays and if the problems resulting from these events have been fully resolved. In terms of the new Courts of Appeal building design cost, the design of the new Courts of Appeal building is close to completion, and construction is expected to commence midway through fiscal 2024. The project cost estimate should be updated prior to the legislature's final decisions on the fiscal 24 capital budget. The Judiciary should comment on when the final cost for design of the Courts of Appeal building will be made available. For GO bond recommended actions, the DLS recommendation is to approve all authorizations and pre-authorizations for the Judiciary. On page 3, we start with the summary of each of the projects. For the new Courts of Appeal building, Exhibit 1 on page 3 shows some differences between the 2023 and 2024 CIPs. The projected cost for the new Courts of Appeal facility has increased by more than $60 million in the fiscal 24 capital improvement program over the fiscal 23 estimate. Notably, the amount for spending in fiscal 24 more than doubled, increasing from $21 million to $54 million. And a full breakdown of the changes, as previously mentioned, is in Exhibit 1. This project has changed in several ways over the past year. The first change is that the project is now expected to need funding through fiscal 26 as opposed to fiscal 27. The accelerated timeline is accompanied by a significant increase in costs, with the total cost of the project increasing from $127.1 million in last year's estimate to $189.5 million in this year's estimate. In terms of concerns, the estimate upon which the project budget has been set is based on the schematic design drawings. With the design effort scheduled to conclude in June 2023, a more reliable 50% construction document estimate should be forthcoming, and the Judiciary should comment on when a 50% design estimate will be made available. Additionally, the Judiciary should comment on whether the established budget is sufficient and on any value engineering efforts which have so far been made in this project. Moving to page 5 for the new Harford County District Court. This project involves construction of a new courthouse in Bel Air for the District Court of Maryland for Harford County, including on-site parking, access roads, and site improvements, in addition to the actual facility itself, with an estimated completion date of July 2029. Acquisition of the final piece of property needed for this project is due to occur in fiscal 24. The delay in full property assembly has resulted in the deferment of initial design for 1 year to fiscal 25, and construction will begin hopefully in fiscal 2028. The Judiciary should comment on when the committees will receive notification for this project, as required by Section 10305 of the State Finance and Procurement article. On page 6, we see a discussion of the Washington County District Court renovation and expansion, involving the renovation of the existing courthouse in Hagerstown, including the construction of an addition. The project status and schedule, due to the dismissal of the prior design consultant by DGS, the completion of this year's project has been delayed by 1 year, the completion of this project has been delayed by 1 year. The contract was terminated due to the former consultant's failure to meet its contractual requirements, which has delayed the start of construction from July of 2022 to April of 2023. project is now scheduled to be completed in October 24 and cost an additional $1.5 million compared to last year's estimate. In terms of concerns, the judiciary should comment on if the project's scope has been finalized and if the amount budgeted will be sufficient to award the construction contract. On page 7, we find the Shillman Building conversion, which involves significant changes to the existing courthouse in Baltimore City, primarily the renovation of the building to provide space to include 7 courtrooms, along with some modern safety standards and maintenance resolutions. Exhibit 2 on page 7 shows the changes in the Shillman conversion project's cost in the CIP over the 3 years from fiscal 21 to fiscal 23, showing the increase in the project's estimated cost from $55 million to $65 million, and then with the addition of a supplemental in the 2022 CIP to where the project sits today. In terms of the project status and schedule, this project has also been delayed several times in the past few years, with completion now slated for September 2025, and the judiciary should comment on what has caused the delays from the 2021 CIP to the present. And that, Mr. Chair, is all I have for you, and I'm happy to take questions.
Thank you very much, Mr. Polakov. Are there any questions from members of the committee for Mr. Polakov on the analysis? Seeing none, we have today joining us the Chief Justice of the Court of Chief Justice Matthew J. Fader. We also have Chief Judge John Morrissey and also Pamela Harris with the Maryland Judiciary. Thank you for being here. Please proceed.
Thank you, Mr. Chair, Mr. Vice Chair, members of the subcommittee. We very much appreciate the excellent analysis of Mr. Polakov. The judiciary does concur in that analysis and in the recommended actions. The judiciary has also responded in writing to the comments that were made. Those responses were provided by DGS, which is responsible, which manages all of these projects and therefore has the information that is that was requested. I don't know if we've been joined today by anybody from DGS, but they do have, it doesn't appear that we do, but they do hold most of this information. We would, however, be happy to go through the document and any comments you have, but we very much appreciate the subcommittee and the full committee's support of the judiciary's capital budget needs.
Great. Thank you very much, Chief Judge. Are there any questions from members of the committee for the Chief Judges? I do have Vice Chair Jazz Lewis.
It's great to see you both. Judge Morrissey, a good friend. I've seen you in a little while.
Nice to see you.
So I see that this, you all may not be able to respond to this, but particularly the consultant that was, I guess, let go. I'm trying to understand. I see something written in your testimony here, but I don't really understand why were they fired? I don't understand. Did you get any more than what's here?
Very limited, Vice Chair. I know that the architect from DGS was not satisfied with however they were going to do what they were going to do, and then turned it over to the Attorney General's office to provide a termination letter, and that's my understanding of where it is. I don't know my understanding was the Attorney General were going to issue, they're not my Attorney Generals, they're DGS's Attorney Generals, which is part of the problem. So they were going to have to do a cure letter first, and then they were going to be able to terminate. I'm not exactly sure, despite my attempts, as to where that is right now.
Okay, thank you. I was just curious. Appreciate it, Mr. Chair.
Thank you very much, Mr. Vice Chair. This is Delegate Bridges.
Yeah, just in terms of the Shillman building, I know that you were trying to move some other tenants out so that you could start that project. Have all the tenants been moved out at this point, or do you still have a few more tenants to move before you can start construction?
I'm very pleased, Delegate, to inform you that on Monday we turned it over to the contractors to start the work. So it started with the Secretary of Dollar's headquarters were there. We met years ago, and she had already had in mind of relocating, and so they moved out, and then there was an arm of the Department of Health that was in there, and we found them space, and then that is where our commissioners, like the public commissioners, go. If you want to file an arrest warrant, or charges against someone, you would go to there. So that took us a little bit longer because it's hard to find the space that it had to be open to the public at 24 hours a day with the appropriate security. But they're over there. In fact, we'll be working all weekend this weekend to make sure their stations are up, and we're going to be open on Monday.
Sounds good. Thank you.
Very excited about it, and thank you for your support.
Great, thank you very much. Are there any other questions from members of the committee for the Chief Justices? Seeing none, thank you very much for being here. That
Thank you.
concludes
Thank
the
you.
Budget
Nice
hearing
seeing you,
for
Chair.
Judiciary. The committee will now move on to the Maryland Hospital Association. And our budget analyst is Ann Wagner, who will be presenting the analysis. Thank you very much, Ms. Wagner.
Thank you very much, Mr. Chairman, members of the committee. Looking at the capital budget analysis for the Maryland Hospital Association, the fiscal 24 capital budget provides $8.1 million in GO bonds for the private hospital grant program. This is about $1 million more than planned in last year's CIP due to increased demand for the program and higher construction costs. I'll also note that the latest CIP plans for this program to increase to about $10 million distributed each year in fiscal 27 and 28. Under this program, turning to the program description on page 2, private hospitals can apply for capital grants for projects that improve patient care, especially in relation to the criteria listed on page 2. And then Exhibit 1, that spans on pages 3 through 6, summarizes the 9 projects selected for fiscal 24. I'll highlight here that more than half of the projects are focused on expanding behavioral health services, specifically renovating treatment areas in emergency departments, as multiple grantees described increasing numbers of patients needing emergency behavioral health services. Moving to the issue section, starting on page 8. The first issue discusses MHA's grant selection process, and it highlights that approximately 11 projects supporting private hospitals were funded in last year's capital budget outside of the private hospital grant program, and therefore those projects wouldn't have received the same evaluation through this grant program's process as the programs funded through the grant program. The second issue discusses MHA oversight of ongoing hospital projects. The capital budget includes an amendment to a prior authorization that extends the grant term for a project at the Garrett County Memorial Hospital, but MHA later indicated that a project for the Shady Grove Medical Center would also need a grant term extension, but that change was not included in the capital budget as introduced, and so MHA is asked to explain why that amendment is needed and why it wasn't included in the capital budget or the annual encumbrance report that they provide to the budget committees. Other than that, the DLS recommends approving the $8.1 million GO bond authorization and the change to the Garrett County Memorial Hospital prior authorization. With that, I'll conclude the presentation. I'm happy to answer any questions.
Great, thank you very much, Ms. Wagner. Any questions from members of the committee for Ms. Wagner on the analysis? Today we have joining us Ms. Jane Kranke, with the Senior Analyst with the Government Affairs for the Maryland Hospital Association. Thank you very much for being here, and please proceed.
Hi, thank you. Good afternoon, Chairman Chang and Vice Chair Lewis and members of the subcommittee. My name is Jean Krinke. Here on behalf of the Maryland Hospital Association, our 60-member hospitals and health systems. We appreciate the opportunity to testify in support of the 9 hospital project included in the FY24 capital budget. We'd like to thank our amazing analysts, both Ms. Wagner and Ms. Godwin with DBM and DLS. They've been great to work with, especially as we have several amendments. This year, 10 hospital projects submitted applications for a total of $9.5 million. The Hospital Bond Project Review Committee recommended all 10 for a total funding request of $7 million. We are very appreciative of the governor's generous increase in funding for 9 of those recommended projects, and we appreciate the increase in out-year funding. That will really help us grow the investment in these innovative projects that align with the total cost of care model. We were disappointed that funding wasn't included for Meritus Health for the construction of their medical school or student housing. And we are requesting 2 amendments. So the first, as Ms. Wagner described, is for Garrett County Memorial Hospital. This grant was identified in our annual report process that they needed an extension. There have been lots of delays in procurement of different materials throughout the pandemic, and that has impacted them as well. In addition, we are requesting an amendment that wasn't included in our report because we found out after the report was submitted in October. And so that's for Adventist Healthcare's 2016 grant. The project is completed, but they're asking for additional time to submit all of the documentation required by the state. And And so happy to answer any questions about that specific amendment. And then I wanted to address questions that Ms. Wagner raised in the analysis. One of the questions regarding funding for hospital projects outside the program. And so a majority of those 11 projects are either very large or they're routine maintenance. And our program really focuses on smaller projects that don't require a certificate of need and that are innovative, just given the limited amount of funding. And so we think another reason you're seeing lots of hospital projects funded outside the program is because there's not access to capital. Through the HSCRC rate setting system, that only accounts for, expenditures related to caring for patients, not for capital infrastructure. And so until that's addressed at the state level, we'll continue to see hospitals relying on the legislature for capital expenses. Additionally, if they had applied to the program, they would probably score really low if they were like updating windows or security systems and things like that. The other, let's see, sorry, I lost my place. I think I answered all of your questions regarding the amendment and then the funding outside the program. So we appreciate your support of the program and happy to answer any questions. Apologize for stumbling there.
Thank you, Ms. Cranky, for your presentation. Are there any questions from members of the committee for Ms. Cranky of Maryland Hospital Association? Thank you very much for being here. That concludes the budget hearing for the Maryland Hospital Association. The committee will now move on to Department of Health, and the budget analyst is Ms. Morgan Smith. Thank you, Ms. Smith.
Thank you, Mr. Chairman and members of the committee. My name is Morgan Smith, and I'm here today to present the capital budget analysis for the Department of Health. We're going to start on page 4. Page 4 outlines the renovation of the Clifton T. Perkins Hospital North Wing. This is the only state-owned project that has received prior funding that's included in this year's CIP. The project will renovate the 80-bed North Wing at Perkins to a maximum security level and construct a new food service center in the maximum security wing. The current request includes $21.7 million in general obligation bonds to fund the remaining design costs and begin construction. The current estimate is based on the 50% construction document stage in fall of 2022, and after much delay, the design phase is expected to be completed in March 2023, at which time a more reliable 95% construction document estimate should be made available. To this end, MDH and the Department of General Services should advise the committees on the availability of the 95% construction document estimate and whether the proposed authorizations and pre-authorizations will be sufficient to award the construction contract in July 2023 as scheduled. Moving to page 5, at the end of page 5 and on to page 6, there are 4 out-year state-owned projects that are listed, and the decommissioned building efforts is the only project that has received prior funding. The other 3, the SET unit, the facility for children, and the expansion of youth support services and the behavioral health crisis centers will be receiving funding for the first time in the out years. I'll let you read through these at your leisure. Starting on page 7, there's a discussion of the Community Health Facilities Grant Program. And then on page 10, you'll see Exhibit 3, which outlines each project that's included in this program, totaling $11 million in fiscal 2024. Skipping to page 12, there's a discussion of the Federally Qualified Health Centers Grant Program, with Exhibit 4 on page 13 also showing each individual project that's included in the program, and this program is totaling $3.5 million in fiscal 2024. And then finally, starting on page 14, there's a discussion of the facility master plan. This plan was required by the 2018 Joint Chairman's Report, and it was submitted September 2nd, 2021. The plan outlines the decommissioning and the divestiture of these facilities as a priority, and each of the remaining facilities was assessed on its functionality, structural status, environmental impacts, and any necessary updates to maintain the quality of care for the patients that it is serving. Exhibit 5 on page 15 shows the square footage by rating. Within the facility master program, each facility that is currently operated by MDH was rated fair, poor, or good, and 87% of the square footage that MDH currently operates was rated poor or fair. Only 13%, or about 445,000 square feet, currently operate with limited renovation needs. And then finally, on page 16, Exhibit 6 shows the initial timeline that was presented in the facility master plan at the time of submission, compared with the CIP and the projects that are included at this point in time. And you'll notice that on the right-hand side, under the now column, there is bold green lettering, and that indicates projects that have been accelerated from later phases to earlier phases. Due to these changes and recognizing that several of the items were either deferred or accelerated, DLS is concerned about the scope of the facility master plan as it stands now. MDH should brief the committees on the department's plan to update the facility master plan in line with the new administration's priorities, especially with respect to moving patients out of state-run facilities and into community-based care and potential privatization options. Lastly, much of the facility master plan is centered around modern models of care, including serving individuals within their communities. As we know, community-based providers are the backbone of many services provided throughout the department, including the behavioral health, developmental disabilities, and Medicaid waiver programs. However, the state has been seeing a decline in the number of direct care professionals, while provider rates have struggled to continue to keep up with inflation and the rising demand on remaining staff. MDH should comment on whether the plan to transition care to community-based providers is still a priority, and whether an assessment of capacity of the home and community-based providers to accept an influx of new patients has been completed, as well as how transitioning consumers to private providers will impact state employees. Skipping back to page 2 and on to page 3, you'll see 2 recommendations made by DLS. One is to approve all proposed general obligation bond authorizations and pre-authorizations, as well as narrative to ask MDH to submit an updated facility master plan detailing any changes in priorities or timelines, as well as a plan for continuing to provide patient care when facilities are decommissioned or relocated. And with that, I end my testimony, and I'm happy to take questions.
Thank you very much, Ms. Smith, for the analysis. Are there any questions from members of the committee for Ms. Smith on the analysis? Thank you very much. This afternoon we have joining us Secretary Laura Herrera-Scott from the Maryland Department of Health, or her designees. Thank you very much, General, for being here. If you could please introduce yourselves.
Good afternoon, Chairman Chang and Vice Chair Lois, members of the subcommittee. I am Brian Morose. I am the Acting Deputy Secretary of Operations, and I'm the Director of the MDH Healthcare System. And with me is Will Andalora, our Director of the MDH Office of Facilities Management and Development. On behalf of the Secretary, she wishes to express that she regrets not being here today. She had an unavoidable scheduling conflict. But on her behalf, she did ask me to personally thank Ms. Smith and the entire DLS Budget Analyst Health team for their insightful analysis. She is also looking forward to working with all of you and continuing discussions about our state of our healthcare facilities in the months to come. And she had asked me to respond to our talking points, or to our prompts and questions from the DLS analyst. So with that, I'll start with the renovation of Clifton T. Perkins Hospital North Wing. The renovation of Clifton T. Perkins Hospital North Wing is one of the major projects funded by the capital budget and is the state's only maximum security hospital. This construction will renovate the existing existing North Wing, which currently houses medium and maximum security patients, and they will be renovated into new maximum security unit. The Office of Facilities Management and Development has been working closely with the Department of General Services and anticipates a 95% construction document to be submitted in late May 2023. The project should also reach design completion and be ready for bid in early August 2023. And construction is anticipated to begin in early November 2023. In response to, should Maryland Department of Health comment on what barriers exist for further existing project pace, project load and funding, and reasons for concentration of new funding in fiscal 24. I wanted to state that the Community Health Facilities Grant Program is administered through the Office of Facilities Management and Development. That program is intended to support community providers in the expansion of community-based behavioral health. The concentration of new funding in fiscal year 2025 is based on the applicants submitted by qualified applicants. MDH does not foresee any barriers to further increasing project administration load. In regards to Maryland Department of Health providing to brief the committee on the department's plans to update the facilities master plan. In September 2021, the Maryland Department of Health issued the 2041 Facilities Master Plan, a 20-year plan to align MDH's projected patient care needs with the health care services provided or offered by the Maryland Department of Health. Throughout the implementation, the Maryland Department of Health will progressively transform healthcare delivery while improving the quality of care and reducing costs. One of the objectives of the plan was to drive the MDH capital budget submissions. So in coordination with DGS and MDH, we will work to update that plan. The Maryland Department of Health will also hold work groups with various stakeholders to ensure the plan aligns with the needs of the state. In regards to the response of should Maryland Department of Health, whether it plans to transition care to community-based providers is still a priority. The Maryland Department of Health is still in the beginning stages of the process to update the facilities master plan. Throughout the process, the Maryland Department of Health will engage in various stakeholders, including state employees and the home community-based services providers. To date, no assessment of capacity of the home community-based services providers has been conducted. I would like to thank again Ms. Smith and the entire DLS team, and we are here to answer any questions.
Great. Thank you very much, gentlemen, for being here. Are there any questions from members of the committee for the Department of Health? Delegate Grice.
Thank you, Mr. Chairman. So the Whitsitt Center in Chestertown, can you comment on that? And is that part of this facilities master plan to reopen that facility?
You want to take them?
Sure. For the record, my name is Will Andalura. I'm the Director of the Office of Facilities Management and Development for the Department of Health. The Whitsitt Center is located on the grounds of the Upper Shore Community Mental Health Facility, and it's operating currently. It's not closed, and the department has no plans to make any decisions that would impact the operation of that facility.
So they're providing mental health, like inpatient mental health services at that facility now? I thought that was closed.
They are, yes, they are,
Okay.
yeah, and that's being run by the County Health Department.
Oh, all right, thank you.
Are there any other questions from members of the committee for the Department of Health? Thank you very much, gentlemen, for being here. We also have joining us today Denise Gilmore from AFSCME, Maryland. She'd like to come up and provide testimony. Thank you, gentlemen.
Thank you.
for
Thank
being
you.
here.
Good afternoon, members of the committee. My name is Denise Gilmore, and I'm a legislative director with AFSCME, Maryland. We represent the state employees who work in our MDH facilities. First, we are very appreciative of the commitment that we just heard from the department to include state employees as stakeholders in the master facility plan. These patients are like our members, family members, so I know they will really appreciate that. We do have concerns with the master facility plan that was proposed in November of 2021. As it's written, by 2041, it reduces the bed capacity by over 1,000 licensed beds in the system. These beds are already, in many cases, the provider of last resort. We're operating at census, over census at many of our state facilities, and we simply think that reducing beds right now is not the way to go, but we enjoy, we will appreciate having this further conversation with the department, and we just want to thank the committee for their work last session too, and making sure that we can get here and actually have this conversation with the new administration. So we're looking forward to engaging as stakeholders on this, and we hope that we can continue to keep these beds public and keep providing the excellent care that our members are so proud to do. So thank you very much.
Great. Thank you very much, Ms. Gilmore. Are there any questions for Ms. Gilmore at AFSCME, Maryland? Thank you very much for being here. That concludes the capital budget hearing for Department of Health. The committee will now move on to Department of Public Safety and Correctional Services, and the analysis is presented by Mr. Jacob Cash. Thank you, Mr. Cash.
Thank you, Mr. Chair. My name is Jacob Cash, and I'll be presenting the capital budget for DPSCS. The 2023 CIP includes 11 projects totaling just over for for DPSES. Of this total, $43 million is being funded in fiscal 2024 and supports 3 ongoing projects. Of note is the Therapeutic Treatment Center, Phase 1, which receives $12.6 million in planning to continue the design phase, which commenced in January of 2023. If you join me on page 2, you can see the summary of capital funding for DPSES projects by the year. Most of the anticipated costs are in the out years, and they increase substantially as the Therapeutic Treatment Center is beginning construction. Moving on to a brief discussion of the inmate population on page 4, Exhibit 1 shows the number of offenders under DPSES custody over the past decade. Since fiscal 2013, the number of arrestees processed declined 74%, the average detainee population declined 24%, and the incarcerated population decreased 31%. So far in fiscal 2023, there has been a slight increase, though, in the inmate population. However, bed space capacity is only a concern in the Baltimore City pretrial complex, which has only recently been able to house all of their offenders under jurisdiction in the Baltimore City complex. From 2015 to 2021, hundreds of detainees were housed in the Jessup region until enough space opened up following the COVID-19 population decline of sentenced offenders. Exhibit 4 on page 6 breaks down the overall $1 billion capital improvement plan for DPSES. The plan overwhelmingly supports security improvements for facilities and new specialty housing units. The most expensive projects are the Therapeutic Treatment Center at $503 million, the Jessup Regional Infirmary at $164 million, and the ECI High Temperature Distribution Project at $71 million. Costs for all DPSES capital projects increased on average by 16%, and that's mostly due to the escalation in the out years being higher than when they were initially planned. Now I'll move on to some project summaries, starting with the Therapeutic Treatment Center on page 8. This project is the planned replacement for the Baltimore City Detention Center, which the state demolished after closure in fiscal 2015 due to abhorrent conditions. The facility issues are in relation to the Duval versus Hogan settlement agreement, which is the modern version of an existing consent decree from the U.S. Department of Justice to improve local jailing conditions in Baltimore City. DPSES is still out of compliance with that agreement, and this project is part of the solution. The planned facility will consolidate therapeutic substance use disorder treatment, mental health treatment, and medical treatment. The overall project is the most expensive state-owned project ever considered by the state, and it's expected to require approximately $1 billion after both phases are completed construction. The facility would also incur large operating expenses as the department opens it up to detainees following the completion of Phase 1. It's expected that a private contractor would be providing the medical, mental health, and deflection services that are core to this facility's operations. Phase 1 of the TTC project is underway and receives $12.6 million in general obligation bond funding in fiscal 2024. Construction is tentatively scheduled for December of 2024, and two planning contracts are in place, and work is ongoing. Exhibit 5 summarizes the project changes since the project was last approved in the former CIP. Due to project delays and accelerated escalation costs, the total amount of funds needed for the project for Phase 1 of this project increased by 8%, from an estimated $465 million to an estimated $503 million. Additionally, the design set to begin in fiscal 2020, or the design which began in January 2023, has occurred after a number of rescopings, and the CIP is not accurate to what the scope of the project currently is. This is something that the department and DBM, as well as DGS, should work on making sure that future representations of this project are as accurate as possible, considering the transformative and costly nature of this. Next, I'll speak on the Eastern Correctional Institution Steam Tunnel and Perimeter Security Project. The ECI is situated in sandy, moist land, and there's increased weathering of their underground structures, and that has impacted both their perimeter fence and their underground hot water and steam tunnels. These provide heating and hot water services for inmates, dietary and sanitary systems, and they have experienced several issues and closures of those systems, which are impacting the ability to carry out regular operations. The two projects are being combined together, whereas previously they were separated to save costs and space. But this project has been plagued by delays and has been in the final stages of funding for 4 years. Project changes are summarized in Exhibit 6. The 2020 CIP included the project with a 95% construction documents, but it was over budget, and so they went back to the board for value engineering. However, during that process, costs increased, and in the 2022 CIP, the estimate was over $60 million. And now in the 2023 CIP, the estimate is over $70 million. That it's total about 12% increase from the previous CIP, and these project funds have been increasing as delays increase. The final project funded in fiscal 2024 is the Jessup Region electrical infrastructure upgrade. It's needed to replace the failing electrical grid, which serves more than 120 buildings, 4,500 inmates, and 1,600 state employees. There have been 2 total blackouts of the region, which lasted for 3 days each, forced facilities to depend on emergency generators. The emergency generators do not support all facility functions, which presents a safety and a security risk. Both outages were due to pole failures and a disruption of overhead lines on site. There have also been dozens of localized facility failures of breakers and transformers that have aged out. And the estimated cost for the emergency fixture of these electrical failures have totaled approximately $1.7 million since fiscal 2016. Delays have continued for 3 consecutive years for this project, and while design was initially completed in November 2024, construction started in May of 2022, or in July of 2022. The project estimate now stands at $32.2 million, and that represents a year-to-year increase of 32%. The primary justification for the additional funding is need for additional groundwork, rework specifications, and an increase to metal material costs. Finally, I would like to bring up an issue, which is the Women's Pre-Release Center. The legislature has made a priority of building a new Women's Pre-Release Center in Baltimore City, and the establishing legislation required DPSES to identify a location, acquire property, and design a site plan on or before November 1st, 2021, as well as beginning construction by February 2022 and begin operation by November 2023. The department has not met the first or the second stipulations. However, they are working with the necessary partners to establish this project. The program Part 1 and Part 2 have been submitted as of December 16th, 2022, and they've made progress toward acquiring a location. That proposed site is in Baltimore City at 1624 Utah Place. It is currently the site of a school, and it is about a half a mile from a metro stop, as well as in a National Historic District and a local historic district. It's estimated that the design phase would require at least 1 year, and the construction phase would require approximately 2 years. So if no further delays are seen, that means the department could meet the legislative requirements by March of 2025 and March of 2027 for the construction and the provision of services. Current estimate is preliminary for this total facility, but estimates indicate that the 64-bed facility would approximately cost $87 million. The legislature did include a pre-authorization of $2 million in fiscal 2024. However, no funding is currently in the budget because that funding was not requested by DPSES in this year's CIP request. DPSES indicated that this was a mistaken, or that this was a mistake, and that they have attempted to work with ZBM to rectify that situation. However, currently there is no funding in place for this project. In summary, DLS recommends to approve all of the general bond obligation authorizations, as well as the pre-authorizations for these projects. If there's any questions, I'd be happy to answer them, but that concludes my presentation.
Great. Thank you very much, Mr. Cash. Are there any questions for Mr. Cash? Delegate Corman.
Thank you, Mr. Chairman. Thank you, Jacob, as always. What year did the legislature require the Women's Pre-Release Center?
Which year the legislation was passed is 2021.
Yeah, and I think we had to override it, and maybe we...
Yeah, and then there was an override that winter. And so in the analysis, it includes the adjusted dates for that override.
Okay. Maybe we passed it in 2020 and overrode it after that. in 2021. Can you just show me where in the CIP there's a page for the Women's Pre-Release Center?
There is none.
There's no page in the CIP for the product the legislature mandated in law?
No.
Okay, thanks. Thanks for clarifying. Thank you, Mr. Chairman.
Thank you, Dr. Corman. Are there any other questions for Mr. Cash on the analysis? Thank you. This afternoon, we have joining us Secretary Carolyn J. Scruggs with the Department of Public Safety and Correctional Services. Secretary Scruggs, thank you for being here. Please proceed.
Good afternoon, Chairman Chang, Vice Chair Lewis, and members of the Capital Budget Subcommittee. For the record, my name is Carolyn J. Scruggs, and I'm the Secretary of the Maryland Department of Public Safety and Correctional Services. With me today are Annie Harvey, the Acting Deputy Secretary for Operations, John Gauthier, our Director of Capital Construction, and James Dunkerson, our Deputy Director for Capital Construction. Mr. Cash, thank you for that thorough analysis. As always, the great job that you do. The analysis contains one issue and one recommended action. The Department concurs with the recommended action. Regarding the issue, I've been asked to respond to the security upgrades by the Maryland Correctional Institute, Hagerstown, and the Roxbury Correctional Institute, also in Hagerstown. The scope of each project has not changed. A review of the projects, both by this agency and the Department of General Services, identified the need for an adjustment to the project costs to more accurately reflect the current environment. Simply stated, labor and construction costs have increased from what it was originally estimated. Although I was not asked to comment on this, I would like to address the women's pre-release funding. As you know, I was appointed to Secretary January of this year and confirmed this session. When the FY24 budget was published, I was quickly inundated with questions regarding the lack of funding for the budget for the Women's Pre-Release Center. This was an oversight on the department's behalf, and we have begun to work with DBM to request the pre-authorized funds to be added to the FY24 budget. As stated in the previous analysis, the department and DGS submitted the program Part 1 and 2 for the Department of Budget and Management on December 16, 2022. The project remains in Part 1 and Part 2, and a detailed accounting of the status of the project was provided via a joint chairman's report that was submitted by DGS in conjunction with the department in January of 2023. As previously stated, the department concurs with the recommended actions, and we are glad to answer any questions you have.
We have a question from Vice Chair Jazz Lewis.
It's good to see you, Madam Secretary. I guess I'm just going to go straight, to the point. How did the oversight happen? I mean, this is a very public project that we've been working on for a number of years. I, for one, when we first started working on this, was on the Judiciary Committee with many of the folks sitting behind you working to secure funding for it then. I know your staff clearly started on this with, the phases that you just referenced. So I'm a little curious then, with the CIP, then how did that happen? Clearly you guys are working on it. How is that possible for it to just be?
So I'd like to shift over to Mr. Gauthier so he can give you some insight as to what happened there.
It was, thank you for your question. This is John Gauthier, Capital Construction, Facilities Maintenance. It really was simply an oversight, and the CIP was reviewed by 3 different parts of our organization. It was missed by everyone. We were well aware that there was a $2.1 million earmark available, but it never made the master list.
Well, I can say this is not on behalf of the chair or any of my colleagues here, but it's very concerning to us. One, this project is really important to a lot of our constituents and our colleagues here, but also in just our capacity for planning things in the CIP. that, things can be overlooked. It's obvious, from the operational and capital side, Department of Public Works is a large part of our budget.
Sure.
We are seeing pretty significant cost overruns in other projects, and these things that are already appropriate being just kind of missed is very concerning. I know you guys moving forward from here are really going to address this. We have a lot of people here today that normally aren't here for the interesting stuff we talk about on capital, for this obvious reason. And we need to work together to make sure that we get back on schedule, nothing is missed. I know you guys, we put together an expedited timeline. We don't typically do that, but it's because this is so important to us. The only other thing I want to mention, which was not an issue page on here, that I just want you guys to respond to, is in the past, this legislature and me as the sponsor have worked on issues of restrictive housing within our correctional facilities. And I just wanted to know if Madam Secretary or your staff could comment on any work you guys may be doing to help address restrictive housing or some creative ways of moving inmates within the facility so that they're getting time outside. We all are trying to address the shortage we have in correctional officers, and we're moving some bills that our speakers led to really address the state workforce to help you guys. But I had to ask on what are we doing there too.
No, thank you for that question. And we are constantly looking at our restrictive housing policies. We're looking more discreetly with having our hearing officers look more discreetly at a matrix that is used so that we can determine whether an individual really needs to be placed on restrictive housing, or are there lesser penalties such as taking a visit from them or maybe a cell restriction. Other things that would prohibit them from being long-term restrictive housing. We're also encouraging our wardens to make sure that they initiate their reviews of restricting housing, which is part of policy, to determine if that person they can override what the hearing officer has said, to determine has that person been on there long enough? Does their adjustment history prohibit them from having to be on there for 30 days, and maybe 15 days is only sufficient? So our hearing officers are working diligently to review all of those cases, and we do have now, as part of our offender case management system, that review for the warden to do. So we are making sure through my DSO and my wardens and my deputies below her that they are making sure they review that with restrictive housing. Those individuals are still being given services. We're making sure that the social workers are available to them. We're making sure that mental health is available to them, as well as medical. And just within the last 2 years, we've also began to ensure that they were engaged in reentry services.
Mr. Chair, just my last thing. I really appreciate you talking about the date specifically, because obviously there's a UN convention that talks about how 14 to 15 days is the longest a person should be placed there. So you speaking directly that is appreciated, as well as the reentry part, because we know 95% plus of the folks that are in your care on behalf of the state are coming home, right? And those services are critical in helping us prepare them for successful reentry, so that they can be their best selves and partners in society. So thank you, Madam Secretary, for your comments.
Thank you.
Thank you very much, Vice Chair Jazz Lewis, for all the questions. Next question we'll take is Delegate Resnick.
Thank you, Mr. Chair. Thank you, Madam Secretary, for being here, and all your staff. I have a question concerning the Therapeutic Treatment Center. We had raised some concerns about this center with the previous administration. Those concerns were left unanswered. And the concerns are that this Therapeutic Treatment Center, by every description, is basically going to be a behavioral health facility. And why is it that we are placing this incredibly large behavioral health facility within the Department of Public Safety and Corrections with a contracted staff to provide medical needs, when we have an entire behavioral health administration within the Department of Health who has for at least a decade or more been treating forensic patients within all of our facilities, such as Perkins and others? Why can't we simply allow that department and the experts within that department to continue to provide behavioral health services to forensic patients in a setting that is new and up to date, instead of allowing the Department of Corrections, who for at least a decade, if not more, has had no experience in doing this, so you have to go out and get contractors instead of state employees to do this?
So I thank you for your question, and I think it's twofold. One, I'll be happy to review that option with Department of Health and my partners, especially with Secretary Herrera Scott. We can have that conversation to see how they can be infused into that center. If you know the population that comes into the Baltimore City booking, having worked there as a warden, many of those that come through that population have severe mental illnesses, substance abuse treatment is needed, and their behavior may not always be as such that arrest is appropriate. So looking at that population and trying to target Baltimore City and deferring them from having to go through the process of arrest and yet allowing them to be treated as they need is one of the reasons that the focus was for Baltimore City and focus was through our pathway through the detention center. It will also allow them, though, once receiving that treatment, for a review to be conducted to determine whether that pathway is still arrest or whether they go through the Maryland Department of Health to one of their facilities. So that's basically why we made that decision.
Just as a follow-up, thank you for that. And I 100% agree with you that a number of the people who are brought in through our justice system need treatment, not jail time. And I agree with the facility needing to be in Baltimore City, and I agree with everything that is in the plan. My concern is that it is being conducted by the Department of Public Safety and Corrections, which is not the treatment arm of state government, and not by the Department of, rather than it should be by the Department of Health, which is. And so I appreciate if you would reach out to the Department of Health and Secretary Herrera Scott and see if either a transfer of the entire facility can take place or a joining and partnership can work together so that this is not viewed as a corrections facility and is viewed, in fact, as a treatment center.
I will absolutely do that. I am more for the partnership because I think there is a role that we can play within that development, and I know that Secretary Scott would be happy to do that as well because I have constant conversations with her now.
Wonderful. Thank you.
Delegate Solomon.
Thank you, Mr. Chair. Thank you, Madam Secretary, for being here. I just want to echo the comments of the Vice Chair on a whole host of issues and really appreciate his incredible leadership on these issues from before even coming onto the Appropriations Committee. I wanted to talk about the pre-release center, and I know there's a number of folks in the audience, a couple who are constituents who have been working diligently and tirelessly for 4 years on this issue. And I know you're relatively new, so appreciate the mea culpa on behalf of people working at your department. And so I guess my question is first question is for Mr. Gauthier. How long have you been with the Department of Corrections?
18 years.
And as my colleague mentioned earlier, this was a bill that was passed in 2020. The General Assembly then came back and overrode it in 2021. The original legislation was bipartisan, supported by members of both parties in both chambers. The budgets that funded this were bipartisan, overwhelmingly supported by members of both parties in both chambers. Can you tell me confidently that there was priority given or that the department took the necessary steps once that legislation went into effect to attempt to meet the timelines that were laid out?
When it was put in front of me for the first time was August timeframe, and at that point we moved in-house funding to get the program written. Up until that point, the program had not been addressed at all.
So despite the fact that, just to be clear, despite the fact that the bill was passed 2020, the veto was overridden early in the session of 2021, and budget money was allocated following that. The first time that you saw it and that your department paid appropriate attention to it was in August of 2022, correct?
Correct.
Well, obviously we're not going to relitigate with the previous administration, but I just want to go on the record how horrifying that is, and the incredible disregard not only to obviously the co-equal branch of government that we all sit and are members of, but the incredible disregard of the advocates and community members that poured their heart and soul into making sure that that legislation got passed and was appropriately funded. And we'll hope that this administration, I know this administration, will have a commitment and will do better. Thank you, Mr. Chair.
Very much, Delegate Solomon. Chair of Public Safety Administration, Chairman Bridges.
Thank you, Mr. Chair. Thank you, Secretary. I'm not touching it. All right, thank you. Thank you, Mr. Chair. Thank you, Secretary. I get to see you a couple of times, and so, you know, we have conversations all the time. We haven't gotten too much into the conversation about the Women's Pre-Release Center as much. I know when we spoke, I don't know, earlier this session, you did mention the fact that there would be something in the supplemental budget. It was an oversight. But, you know, I am the forever optimist, and I do believe that that could possibly happen and will happen. But I just want to make sure that there is a contingency plan or know what your plans are to keep the momentum going if that is not put into the supplemental budget by DBM. Are you working on some sort of contingency plan so that we're not looking at this again next session and wondering what happened, how the ball got dropped, or where the funding has gone in order to keep this moving?
Sure. So we are absolutely going to ensure that that money is placed back into the budget. As early as today, Mr. Gauthier was having conversations with DGS so that the proper documentation can be submitted to DBM so that that money can be put into the budget. We are always looking at contingency plans just as we do right now because we do not have a women's pre-release center. So our women, right now there are approximately 24 women in Baltimore City that are pre-release eligible right now. And we are also looking to ensure that they may be work release eligible. That way they are not still housed within population, but they have that work release option to go back and forth into the community until we can get a structure built. We also created at the Women's Institute, it's a housing unit, it's an honor housing unit. It's called Project Fresh, and it's exactly for that. And we begin to bring services to those women that we know should be in a pre-release or work release status so that they can get some of the services that they would receive were they in a building structure of their own. But I can guarantee you we apologize for the previous administration for the oversight, but we will ensure that it gets into the budget and we will move forward and aggressively as we can with our DGS partners to get this done.
Thank you for that. And you did mention, Mr. Chair, if I could just ask one additional question. You did mention DGS, and so there is a partnership that's to be held within both your department and with DGS. And so while you make the budget request, DGS is really the, I guess, agency that moves this process along on behalf of your agency. And so I guess my question is also that we should also not just be putting pressure on you to keep this in the budget, but also on DGS to move this project forward. Would you say?
I agree with you, sir. Thank you for that.
Yep, thank you.
Thank you. Delegate Bridges, Delegate Corman.
Mr. Chairman, Madam Secretary, congratulations on your new position within the department. We're talking a lot about the budget, and it is a provision of the budget. It was a pre-auth, and you know there's some process you all have to follow to make sure a pre-auth gets funded. But this is also in Section 3-301 of the Correctional Services article. You have your own article in the Maryland Code. We don't usually mess around with that article very much in the Appropriations Committee. Our colleagues in the Judiciary Committee do that. So how do I assure my colleagues in the Judiciary Committee that all the other changes they make to the Correctional Services article in a given year that are written in statute and printed in those red books in our office are actually going to be followed by the department when thus far you haven't followed, as near as I can tell, Section 3-301 of the article?
So one of the things that we are doing is we are reorganizing the department right now so that we can better communicate to staff and better educate staff as to what the policies and procedures are. Staff will be held accountable for not adhering to those policies and procedures, and there will be review and oversight of every needed aspect that we have to report out on.
A follow-up, Mr. Chairman? Thank you. So as part of the supplemental request, will you be putting in a page to the CIP that provides more details about the project beyond just the one-year funded pre-auth?
Mr. Gauthier, is there additional page?
Yes, yes.
Okay.
The program has been completed, both parts 1 and part 2. Preliminary schedule and a cost estimate worksheet has been completed. We haven't, since it was put in my hands in August, we haven't stopped. We've kept moving.
So when would I see a page that looks like all the other pages in the CIP?
I would assume it would be part of the supplemental budget.
I mean, normally the supplemental doesn't come down with CIP pages. It just comes down with a line item in a budget page, so would you be willing to provide a CIP page to the committee?
I would have no reluctance whatsoever.
Yeah, okay.
Great.
We'll absolutely do that, sir.
We'll look forward to receiving that. Thank you, Mr. Chairman.
Thank you very much, Delegate Carmen. Are there any other questions for the Secretary and her team regarding this? I do have a few questions for you. Thank you, Madam Secretary, for being here and for bringing your staff with you. Just for clarification, when did the department and when did your staff start reaching out to DBM and DGS about the oversight?
That would have been at the same time, in roughly August, September timeframe.
And then it was brought to my attention once I came on board in January, and I know we have been having those discussions since then.
Okay, and then where in the process are you now with regards to DGS and DBM of actually getting that in there and having that come to fulfillment?
As I said, the program parts 1 and 2 have been completed. The preliminary budget has been developed. The location has been selected. Putting the supplemental budget together process actually begins tomorrow, and it's basically a one-line document.
Why are we at the point where it's starting tomorrow? What happened?
What happened from where I sit is the costs were not identified until January, and the $2 million original earmark was not enough to begin the design process overall. An $80 million roughly facility is not going to be designed for $2 million. So
you said that you started working on this in January?
Yes.
And
the program was completed December 16th, and we started working towards resolving the budget issues in January.
Okay. Can you walk the committee through this a little bit? So if you have a project out there, and do you all normally have a CIP plan that's established, and when does that CIP plan usually get established? When you have a project out there that you're looking at planning and design or construction?
Candidly, I can tell you that this is not how we normally develop a project. Usually, there is a lot of forward planning done. Everything's identified as far as need goes, and then we submit it as a part of the CIP, wait for the funding to be allocated, and then begin the actual program and design process.
Okay.
This was out of the ordinary, and again, it was handed to me in August of 2022 to begin the work.
Who handed it to you in August?
That would have been the previous secretary,
Okay.
Robert Green.
Thank you very much. Appreciate it. Are there any other questions from members of the Appropriations Committee for the Secretary and her staff? Thank you, Madam Secretary, for being here, and thank you for your staff for being here. But obviously, from this subcommittee and this Appropriations Committee and then in the General Assembly, this legislature, this is a very important project. And we really need to see movement going on this, and specifically hard deadlines as far as dates, when we're going to get the CIP established, and other milestones. And I think that's important for all of us to be able to see that actually concretely written and established. And this afternoon, I think we're going to hear a lot of our testimony from other advocates out there. But thank you very much for being here, Madam Secretary. Very much appreciate it.
Thank you.
All right, this afternoon we have joining us several witnesses, and to reminder to all the witnesses, if you could limit your testimony to 2 minutes, and we'll call up the following individuals. We have Elizabeth Starnes with No Struggle, No Success. Okay. How about Denise Gilmore with AFSCME Maryland? And then Olawada Mulo Olalianian with AFSCME Local 1678. And Beth Tomasello with the Montgomery County Women's Democratic Club. Beth Tomasello. Okay. And then Psalms Roja with the Marion House. If each of you could state your name first and then 2 minutes, and very much appreciate you all being here. Thank you.
Thank you. Good afternoon, Mr. Chair, members of the committee. My name is Denise Gilmore. I'm a legislative director with AFSCME Council 3. We do have one of our local presidents here, so I will keep my remarks very short, but we did want to go on the record just for saying that as it relates to the Baltimore Treatment Center that was discussed earlier, we're very encouraged to hear that the secretary is willing to have these conversations with MDH about, potentially a more appropriate agency to run that. Generally, the medical and behavioral services in the prisons are contracted, and we just don't think it makes sense to have state funding, support such an expensive facility just to have outside contractors run it. We'd very much like to see state employees, do the work inside of these facilities. So I'll close my remarks and hand it over to President Aladian, if that's okay.
Good afternoon, Mr. Chairman and all members of the House. My name is Olanio. I'm a sergeant at Jessup Correctional Institution, and I'm the president of Local 1678. Most of our jails are aging and continue to see neglect or delay in repairs of services, exposing employees and inmates to discomfort, security, and safety risk. I discuss infrastructure problems that affect the employees and the inmate population during my labor management meetings with the administrations, hoping to get them resolved. But unfortunately, administrators respond by saying it's a capital project and it will take time to get the approval of fund. Lack of personnel, fund, and reactive maintenance culture unarguably puts lives at risk in our correctional facilities. Summer and winter season in prison comes with chaos and pains for the staffs and the incarcerated persons. Inmate cells and the buildings are extremely hot during the summer, while the winter season is the most pathetic period. The inmates are subjected to cold and poorly treated. Cell windows are broken or could not be controlled from the inside as maintenance delayed to switch the heat on. Unsecured and malfunctioning cell doors in our facilities need urgent attention as it creates safety concerns to staff and the inmate. Our control panels are routinely broke down without repairs for several months, leaving the officers to manually open the doors and prone to attack during the process. The department's culture is reactive instead of being proactive to issues. We have seen it displayed out often. Contracts are given out without maintenance warranties, as in the case of offense intrusion systems, control panels, and many more. Finally, we still support the building of the women's pre-release facility and urge the committee to push the department to get it done. Thank you for providing this oversight. Thank you very much.
I think I'm next. Okay. Thank you, Chair Chang, Vice Chair Lewis, and members of the subcommittee. My name is Beth Tomasello, past president of the Montgomery County Women's Democratic Club, a proud member of the Women's Pre-Release Equity Coalition, and I would like to thank the members of the committee for their engagement with this issue and trying to hold DPSCS to account. Because as you know, whether and when DPSCS builds the Women's Pre-Release Center, it's not a choice, it's the law. And I'd like to provide a little context to the delays that we've seen. As Mr. Cash outlined, the department has missed every single deadline established in the statute for reporting construction and operation of the pre-release center. DPSCS waited 7 months after the veto override before requesting a DGS project manager, and only after the General Assembly forced the department to accept $150,000 in operating fund did DPSCS hire a planning consultant whose report was due in December 2022, which nobody has seen, by the way. The department now states that it needs 18 months to accept this planning report. By then, nearly 3.5 years will have elapsed since the veto override without a shovel going in the ground. To place this in context, it only took DPSCS 2 years to plan and construct Phase 2 of the Dorsey Run Correctional Facility, a 560-bed, 80,000-square-foot prison. And incarcerated women cannot wait until 2027 at the earliest for pre-release facility and services. Too often, this department spends taxpayer money on carceral practices with proven negative outcomes, including a 40.5% recidivism rate. In 2021, the General Assembly rightly mandated that the department implement a data-driven, proven program which will reduce recidivism, create better outcomes for returning women and their children, and will save taxpayers money. Community-based pre-release programs save $13,000 a year per woman over incarceration, and for every dollar spent on community-based pre-release services, the state will save over 5 times that much in long-term costs. Although DPSCS requested FY24 funding for the Women's Pre-Release Center, it did request current or future funding for 11 other non-mandated capital projects, 10 of which will have no bearing on carceral outcomes. The department's priorities are clear, and they do not include complying with the law. WDC respectfully requests that the subcommittee fully fund the Women's Pre-Release Center in FY24 and require a capital plan for the completion of the facility. It is time for DPSCS to comply with the law and provide returning women with the services they need. Thank you very much.
Hi, good afternoon, Chair Chang, Vice Chair Lewis, and members of the House Capital Budget Subcommittee. If you could forgive me, I'm going to go a little on the fly here because evidently you don't need my spiel. Also, for the record, Psalms Rojas from Marion House, member of the Women's Pre-Release Equity Coalition. And like I said, I'm going to go a little candid because evidently you are co-advocates for this pre-release center, and we truly, truly appreciate you all holding the department accountable for this project. We heard today from, I forget the gentleman who was sitting here, head of the capital projects, that their process is to first identify the need and then they go about finding facilities and whatnot. And so it is evident that this was not a need that they identified, and so it is not a priority for them, and they are certainly acting like it. So we appreciate that it is a priority for you all, and just want to mention, as in our work at Marion House, we serve women who are coming out of incarceration and essentially providing wraparound services that they truly should be receiving in a pre-release center. And we have been doing this for over 40 years since our founders were working in these jail systems. And what we have found in our longitudinal studies is that the women who complete our program and you know, Marion House is great and special, but whatever, but women who are receiving these support services, they appear on the Maryland wage records twice as much as women who are not receiving these services. They're appearing at almost twice as much, they're achieving twice as high wages than women who are not receiving those services. And the recidivism rate for our women is 11%, which is a stark difference from the over 40% recidivism rate in Maryland. That's what we're talking about when we're talking about over a decade of women not receiving these services, not receiving the support that they deserve. So it is not lost on me that this Women's History Month, this International Women's Day, we're asking for continued support, continued advocacy to make sure that this project is complete and funded and completely invested in. Thank you.
To the panel, are there any questions from members of the Appropriations Committee for this panel that's presented before us? Thank you very much, everyone, for being here. Thanks for your advocacy. We'll call up the next set of witnesses. We have Matan Zeimer with Jews United for Justice, Monica Cooper with the Maryland Justice Project, Nicole Hanson-Mundell for Out for Justice, Jason Billingsley, Out for Justice. And how about Pamela Seidel with, excuse me, that's it. Okay.
You want to go first, Nicole? Thank you, Chair. Thank you, Vice Chair, members of the subcommittee. My name is Matan Zeimer. I'm a Maryland community organizer with Jews United for Justice, which organizes over 6,000 Jews and allies across our state. We're also a proud member of the Women's Pre-Release Equity Coalition. I am also going to go somewhat off script. Couldn't help but get somewhat emotional in hearing your direct questioning of the department. It feels like a long-awaited and final recognition of the advocacy that our partners in this coalition have been putting in for well over a decade, and a recognition of the experience of women who are incarcerated in our state who have been denied these services for over 13 years. I first got the privilege of working on this issue when I was in Senator Mary Washington's office as a legislative staff. I've since had numerous roles now working with JUFJ and have had the privilege to continue to work on this issue. And it's been incredibly, incredibly frustrating, as you all clearly understand, to come in here to hearings year after year and hear from the previous secretary delays and delays, sort of empty promises that this was a priority. So to hear finally real answers about that this was not a priority and that they're owning that and sharing real dates of when they got started on this, it is heartbreaking, truly heartbreaking, but also at some level a real relief to finally get the truth. So I cannot thank you enough for asking these really important questions and continuing to push alongside us to get these answers and to move this forward. Again, this is far off what I was planning to say. The two quick things that I did want to say, we're appreciative that we hear the efforts to put the $2+ million back in the budget that was pre-authorized. A concern that we have is that we've since heard from DGS that they actually need closer to $5 million for the next phase. As we heard from the capital budget person from DPSCS, that previous iteration or previous steps have been delayed because they didn't feel like they had enough money. And we're deeply concerned that if that ends up being the case again this year, that we'll be back here again next year, which we know you don't want and we certainly don't want, saying, why didn't this move forward? And them saying, well, we just needed an extra $2 million. Well, let's address that now, right? We would love to get an answer from DGS. We would love to get that page in the CIP so we can have a real answer. What do you need to get this next phase done? And how can we move to getting this fully funded so we don't have to come back here year and year again to testify and ask for these things, and also to have people come and tell their extremely personal stories about their life being incarcerated in Maryland. I mean, I wish Elizabeth was here today, who shared her story yesterday, but just horrible, horrible stories of what's happening and ongoing right now as women wait for these services. So with that, I stand with you all in pushing for full funding of this to move this forward. We're here to be partners in this process for whatever we can do to help advance it. And I thank you for your time and your effort.
Good afternoon. I'm Monica Cooper. I'm the Executive Director of the Maryland Justice Project. And I first want to say I'm so glad that the Secretary left, because I am really excited about her appointment to be the first African-American Secretary of Corrections. And I just so happen to really admire and respect Ann Harvey. So I'm glad they're not going to hear what I say unless they look at the tape. But besides that, I really wanted to just emphasize that a phrase that I coined is a fiscal veto. And I feel like that's what the previous administration did. When you get those overrides, the administration still has the potential to delay, and do what I call a fiscal veto. And unfortunately, the Department of Corrections has followed suit, and they delayed and made excuses. But also what they have done is they have caused extreme harm. I received a phone call from a young lady whose mother was concerned that the Department of Corrections released her to Baltimore with $40, and the mother did not know where she was. So what they've done is they have dug themselves into a terrible ditch where they are not classifying the women because they don't have actual pre-release services or buildings. They are sending women to work in the kitchen, and they call that work release. They have women that are paying to stay inside of a maximum security prison $500 to $1,000. They take them to their workplace for $5 to $10, according to what they make, in a Department of Corrections van. When people get out, that is embarrassing. When I got out, I did not want to show up at my job and say, yeah, I'm, Monica Cooper, 912878. No, I am now Monica Cooper, proud graduate of the University of Baltimore, now working in Ivan Bates' office, in the state's attorney's office. That's who I am. And when women are processing through that, we have to convince them that you can be a data programmer. We need people to pay tax dollars. My taxes are too high. We need people to work. And the department has really failed and have caused extreme harm. And I could go on case by case, but their delay has actually really dug them a ditch. I know you saw the guy squirming. I'm just going to keep it real. He could not answer those questions because it's so harmful. I'm just going to leave it at that. We really have to get this funded immediately so that you can have more Monica Coopers paying taxes and doing well. Thank you.
Good afternoon. Before I start, I would like to, I thank you, Delegate, for acknowledging, but I would like to acknowledge and have all the people who support us today, please stand really quickly. Thank you. So people have traveled a long way to come and let you all know that they support this issue, and we'll keep coming back. Thank you all. For the record, my name is Nicole Hanson Mundell. I am the Executive Director of Out for Justice, a grassroots organization led by formerly and currently incarcerated people. And I, thank you all for asking the tough questions. And I know there's some people in this committee who don't care to ask certain questions, right? And so it's really rewarding to hear the tough questions asked. What would be even more rewarding is to see some consequences for their actions. How can this committee come up with some ways in which the department knows that this is a priority? What happens when an agency does not do what you all legislate them to do? Do they just get up here and give you answers and just answer questions and casually say they didn't do it? Or do you all withhold things in the budget? What could this committee do to actually show the department some sort of consequence? Because in the real world, when we don't follow the law, there's consequences for our actions. I'll talk about money, right? Because, there's this money number thrown around about 87 million and however many million, but I'll say that is not even enough. That's not enough. Because women have been waiting decades to get adequate supports so they can go home and provide for their families and live productive lives. So if we as Marylanders and you as legislators don't start spending the real money on the front end, we're going to continue to pay on the back end. And so now it's time to stop penny pinching issues that really require real money, real thought. And so if it's $87 million, let's figure out where the $87 million. There's a document called special funds. Every agency has to submit what they did not spend every year. $900,000 was not spent in the Oyster Fund. Let's go get that money and provide it for women. And the last thing what I want to say is 10% of incarcerated mothers have children in state custody and foster care. Incarcerated moms are 5 times more likely to have their children placed in foster care than incarcerated dads. An average annual cost of $25,000 a year. And estimated, and this was in 2020, 220 plus Maryland children are currently in foster care because their mother is incarcerated. Maryland is currently spending, in 2020, $5.6 million per year to place children of women at MCIW in foster care. So that's 5, 10, 15, we got 4 years. That's 20 million right there you done already spent on housing a child whose mother could have been out and getting adequate services. And these numbers are much higher if you consider moms of children in pretrial and local jails, and increases in annual cost of foster care since 2011. And so I'll leave on that please, for the sake of public safety, for the sake of ensuring that places like Baltimore, where 7,000 people coming out of state jails come back to Baltimore. And so by not funding this project, what you are saying is you want Baltimore to continue to be in the news of being a public safety issue. You like the fact that our children are running around, not having mothers, supposedly committing crimes, not having anywhere to go. It says to me that you like to see Baltimore in a place of distress when you do not make sure that the majority of people who are coming from our state prisons that come to Baltimore are supported. That's what you're saying when we do not fund this project.
If I could just say one thing.
Ma'am, go ahead.
Chairman? I just wanted to say thank you. I am really proud of you guys today. I have never walked away from a hearing where I felt like I wanted to door knock for every person on the committee. Thank you.
Did you hear that, Delegate Metzger? She's going to come door knock for you. Well, thank you. And just want to verify, too, is Jason Billingsley here?
No, sir.
No, okay. Well, before you all leave, before this panel leaves, thank you very much, everyone, for coming out and testifying and spending time out here, and not just today, but the countless, tireless amount of time you've been down here. We've heard it in the Public Safety Administration, the Operating Budget Subcommittee hearings, and we just want to thank you, everyone, for being here and continue to advocate. And I will say this, that even prior to this hearing today, the Chair of Appropriations, Chairman Ben Barnes, he is fully aware of what's going on with the situation, and obviously the subcommittee is going to be getting with the Chair of Appropriations and talking about the appropriate action that we're going to take to be able to address this and really have concrete results. So thank you, everyone, for being here.
Thank you.
Thank you, Mr. Chang. I appreciate you.
You're welcome. And Delegate Metzger, if you want to get with her about door knocking. All right, great. Thank you very much. That concludes the budget hearing for Department of Public Safety and Correctional Services. The committee will now move on to Department of Aging, and it's going to be presented by Ms. Naomi Kimura, the budget analysis. Thank you very much.
Thank you, Mr. Chairman. My name is Naomi Kimura. I'm here with the Department of Legislative Services to present the fiscal 24 capital budget for the Department of Aging. The Department of Aging manages the Senior Citizen Activity Center's capital grant program and issues grants to local jurisdictions to renovate and build senior centers across the state. Exhibit 2 on page 4 shows the location of existing senior centers, as well as the concentration of individuals ages 16 above by census tract. And then Exhibit 1 on page 3 shows the projects that are being requested in the fiscal 24 request, totaling $1.865 million. Those 3 projects are a replacement of the Jacksonville Senior Center in Baltimore County, a new construction for the East Columbia 15 Over Senior Center in Howard County, and then a roof replacement for Kent Island Senior Center. There's additional information in the analysis about ongoing projects managed by the Department of Aging, but I'm going to conclude with DLS's recommendation for the committee, which is to approve the general obligation bond funds proposed for the Senior Citizen Activity Centers grant program. Thank you.
Thank you very much, Ms. Kimura, for the analysis. Are there any questions from members of the committee for Ms. Kimura on this? Thank you very much. This afternoon we have joining us Secretary Carmela Roque with the Maryland Department of Aging, and also Pamela Seidel. Correct. Thank you very much both for being here, and please proceed when you're ready.
Good afternoon, Chairman Chang, Vice Chairman Lewis, and the committee. I am Bernice Hutchinson, Deputy Secretary of the Maryland Department of Aging, and joining me today is Pam Seidel, our Chief of Staff. Thank you for this opportunity to respond to the Department of Legislative Services analysis of the Maryland Department of Aging's FY24 capital budget request. The department extends its appreciation to our DLS analyst, Naomi Kimura, who reviewed the budget and proposed senior center projects. Ms. Kimura's research and analysis was insightful. The department concurs with the recommendation. Thank you. We are available now for your questions.
Great. Thank you very much, Madam Deputy Secretary Hutchinson, for being here today. Are there any questions for Madam Deputy Secretary, Vice Chair Lewis?
I just want to say thank you for your patience. It's been a long day.
Thank you.
Thank you.
Thank you very much for being here, and we do appreciate you providing the CIPs too, so thank you.
Wonderful.
Thank you.
Thank you all.
Have a great day. That
you.
ends the budget hearing for Department of Aging, and that also concludes the budget hearing for today. Have a great evening. Thank you very much.